Hey, come here. Okay, just an introduction to the NGOs I work with. The first is Global Pragati, and this was founded by Doctors Alok and Sangeeta Agarwal, and it's dedicated to creating healthier communities. And the other one is Swasa Hospital, which was founded by Dr. Vishnu Rao, and this is dedicated to the treatment and prevention of asthma and allergy-related issues. And then again, my name is Shubhi Pathak. I'm going to 12th grade soon, and I've been a volunteer with Breathe California for the last 3 years. And my main focus has been an organization called CLAS, which is Counseling Leadership Against Smoking Pressures. And here they train high school students to go to middle schools and teach them about the topics that I'm talking about today. And again, I'm the secretary for Global Pragati's Youth Council, and I'm in charge of their Stop Smoking initiative. Okay. So my reason for this campaign is that over 80% of smokers start before the age of 18 to smoke, express a desire, wanting to quit. However, 75% of them fail to do so. And out of these youth smokers who go on and smoke in adulthood, 1 out of 3 die prematurely from smoking-related causes. So my goal for this campaign is to educate everybody about the harmful effects of cigarette smoking, as well as empower everybody to not get influenced, and to help others, such as their family, friends, and society. So the topics I will cover today are the chemicals in cigarettes, the short-term effects of smoking, the long-term effects of smoking, effects on non-smokers, influences to smoke, how to avoid influences, and finally, we'll end with the class activity on avoiding influences. So just on each of these following slides, ask yourself if somebody in their right mind would ingest each of these chemicals. So the first is ammonia. Does anybody know what ammonia is used for? Ammonia is commonly used to clean toilets. If you know what arsenic is used for? So arsenic is a rat poison, but it's also extremely dangerous to humans. The third one is formaldehyde. Does anybody know what formaldehyde is used for?
Used for preserving specimens in laboratories.
Exactly. It's used for preserving specimens, dead organs, that kind of thing. Carbon monoxide? Right. So it's a gas that's dangerous to humans, and in this picture here, that's smog, which carbon monoxide is a component of. Tar?
It's used as nail polish remover.
Exactly, it's used as nail polish remover. Cadmium?
It's used in batteries.
Yeah, it's used in batteries. And so the reason I'm talking about all of these chemicals is that they're all found. So some of them, if you can see in the picture here, there's fuel, rocket fuel, hexamine, which is like a barbecue starter, a lot of that stuff. So can anybody guess how many chemicals are in cigarettes? Just raise your hand and throw out a number.
50.
Huh?
About 50.
About 50? Okay, anybody else?
About 100 more.
About 100 more? So 150? Okay, anybody else? Okay, so there's actually over 4,000 chemicals in cigarettes, and recent studies show up to 7,000. So there's 3 main ways that these chemicals get into cigarettes. The first is they're in the soil that the tobacco is grown in. The second is they're added during the manufacturing process. And the third is sometimes when the cigarette is burned, different chemicals are created and released. Can anybody guess how many cause cancer?
2,000.
It's not over 2,000. It's actually just at least 40. However, again, studies show that there's many more. So, there's one chemical in cigarettes that causes addiction. Does anybody know what this one is?
Nicotine.
Exactly. It's nicotine. And this is basically an extremely addictive chemical, and because of it, it only takes a few weeks to get addicted to cigarettes. So nicotine is also an organic insecticide, and in the past it was used. It was discontinued due to the serious effects that it was having on humans that were eating this food. So I just kind of like this picture here because it shows how bug spray kills cockroaches, cigarettes kill humans. So this is the tar jar, and it's basically a smoker who smokes half a pack daily for an entire year, and it's equal to about half a kilo. So as you can see here, the healthy lung, it's kind of light pink and whatnot, and then the smoker's lung it's black and it's damaged, and that's due to the buildup of tar in the lungs when people smoke. Are there any questions on chemicals in cigarettes? Okay, so my next topic is short-term effects of smoking. And these are effects that only take a couple days or even a couple minutes to start happening. So the first and the most serious is addiction. Can anybody define that for me?
Person will be used to smoke every day.
Yeah, so it's someone who's used to doing something every day, not necessarily smoking, but anything. And so addiction, yeah, that you're addicted to. And so just to give an example, imagine you've been doing something every single day for your entire life, and then all of a sudden one day somebody tells you that you can't do that anymore. It would be kind of hard to quit, right? So that's how it feels for people who are addicted to smoking. Well, they try to give up because of the nicotine in the cigarettes, which makes them addicted to it. And there's a famous quote by Mark Twain that says, "Giving up smoking is the easiest thing in the world. I know because I've done it thousands of times." Okay, so smoking can also cause bad breath because the chemicals are left behind in the mouth and even the throat and the lungs, and they can linger there for hours. And another short-term effect is cough or shortness of breath, and most smokers experience this because of the smoke going into the lungs. And then another one, if you can see this picture here, she has stained and yellow teeth, and that's due to the buildup of plaque on the teeth from when she smokes. And her fingers and her fingernails, yeah, you can kind of tell, they're also yellow, and that's because of the chemicals and the ash and stuff. Are there any questions on short-term effects?
How does nicotine cause addiction to smoking?
I'm not exactly sure, but Dr. Rao was explaining it like when you smoke, there's a chemical that's created in your brain called dopamine, and that basically relaxes people and it makes them happy, right? And then when people stop smoking, that chemical stops getting produced, so they go into depression, which is why they keep smoking to try to create that chemical. Anybody else? Yeah.
Why do the nails get yellow?
I think it's from the ash and the chemicals, but I would have to check.
That's it.
Some other chemicals.
Yeah, it's from the chemicals. Okay, so now I'll talk about the long-term effects of smoking. And these are effects that take a couple years to form or to develop, but they're also usually a lot more serious than the short-term effects. So take a look at this picture, and then take a look at this one. So can you kind of see the difference? Yeah, so the story behind the pictures is that these two women are twins. The second woman was. And so, as you can see, the second woman's face is a lot more wrinkled and her skin is more damaged. And so, people who smoke normally get wrinkles a lot faster than people who don't smoke. Because wrinkles are natural as people age, but people who smoke usually get them earlier. So, another effect is heart attack, because the nicotine in cigarettes can cause a decrease in oxygen flow to the heart, as well as an increase in blood pressure and heart rate, and an increase in chances of clotting. And for those same reasons, smokers are also more likely to get strokes, and this can sometimes lead to paralysis. So there's a disease called emphysema, which is basically characterized by holes in the lungs. So when people smoke, the chemicals in the cigarettes start to make little holes in the lungs, And it becomes really hard for smokers to take proper breaths of oxygen. And as it says here, every breath is like breathing through a straw. So since most of you probably don't know what that feels like, everyone make a fist, and then like a tight fist, and then hold it up to your mouth and try to breathe through. Okay, so if you're doing it right, it should be pretty hard to breathe because the air isn't coming through properly. And that's how it feels for people who have emphysema, basically. And this disease is irreversible, so it cannot be cured. And once people have these little holes, it's there for the rest of their lives. So another extremely common and serious consequence is cancer. And cancer can basically occur in any of the areas where the chemicals collect. So this is the mouth, tongue, lips, gums, throat, lungs, and other organs such as stomach, pancreas, kidney, and colon. So the most common kind for people who smoke cigarettes is lung cancer. So this first picture here shows a 42-year-old patient who is dying of lung cancer. And a lot of times the treatment for this problem is to remove the cancerous part of the lung. And so that's reduces weight one lung at a time. Take that forward. Can somebody tell me who she was?
She was a chain smoker.
She was a chain smoker. Cancer. And she became an advocate against tobacco use. And she died this year, recently at the young age of 28 years old. So this here is Babulal, and he basically, he started smoking 1 or 2 bidis per day. And after a while, he got addicted, and he was smoking almost 20 to 25 per day. And after 25 years of smoking, he developed throat cancer. And so there's a YouTube video called The Last Song, in which he basically informs people of the dangers of tobacco use. And it's called The Last Song. Forever. And so the reason I'm showing you guys all these people is that all of them, they started warning about the dangers of tobacco or cigarette use after they developed these problems. So I think it's important for people to know beforehand the effects of. Are there any questions on long-term effects? Yeah.
Even after people know, don't they quit smoking?
A lot of times because of the addiction. So it's really hard for them to quit.
So once you kind of get into smoking, then
Yeah.
you can't come out of it.
Most people cannot. Yeah. Okay, so next I'll talk about. Oh, did anybody else have questions? Okay. Next I'll talk about. And so basically the point is, smoking is not only dangerous for the person who smokes, but it also affects those who are around them a lot. So there's 2 main ways that cigarette smoke gets into the environment. The first is mainstream smoke, and this is when smoke is inhaled by the smoker and then exhaled into the environment. So that one, if you can see on the picture, is the skeleton breathing out the smoke. That's mainstream smoke. The other is side stream smoke, and this is when the smoke comes off the burning tip of the cigarette. Like if you can see the cigarette and the smoke coming off, that's side stream smoke. And the thing is, cigarettes have a filter that sometimes filter out some of the chemicals, but in side stream smoke, the smoke doesn't go through the filter, so it has a higher concentration of all the chemicals. So side stream smoke, which affects both the smoker and non-smokers, is actually more dangerous than the cigarette smoke that comes through the filter. Okay, so does anybody know what secondhand smoke is?
Passive smoking.
Exactly, it's passive smoking. So secondhand smoke is actually just as dangerous, if not more, than firsthand smoke. And this picture here, I kind of like it because it captures that idea. And it says, passive smoke kills your dearest ones first. So this kind of captures the idea that passive smoke is extremely dangerous. And studies show that people who are exposed to too much secondhand smoke can develop the same problems that smokers do. So this would be like cancer, they could still get cancer, they could get heart attacks, all those things. What? Yeah, lung cancer, all of that. So it's really important if you live with a family member who smokes. It is also affecting you. But if you cannot do that, then the next best option is for them to smoke